So, Amy, tell me how I can help you.
I've got a problem like on my chest area. It's quite large, like the nipple area itself, and it produces fluid when I squeeze it myself.
Let's have a look and then we know what we're talking about. So you have quite prominent breasts, don't you? And they've developed that sort of pointiness that gynecomastia, man boobs, as we say, often does get. Show me the stuff that comes out.
You just squeeze like this.
Oh, gosh, you really can, can't you? And the same thing on the other side as well? Wow, OK. And you have to do this, do you?
Yeah, like every single night, basically, before I go to bed, you know, like I don't like getting the pains when I wake up in the morning, so in order to relieve it, I'll do that before I go to bed.
So it starts to hurt if you don't let this stuff out?
That's right, yes. What
you're doing, essentially, is a form of lactation. It's exactly what women do to feed babies, and you are producing the same sort of thing. It's a type of breast milk. Do you generally have a libido? You have a sex drive, or not really?
I've lost it, actually.
So you've lost your libido?
Yes.
Clearly, there is a hormonal problem going on. There's lots of different causes of it. The commonest one is a problem with the pituitary gland. Now, your pituitary gland is just underneath your brain. It's a little tiny gland that secretes a whole range of different hormones. One of those hormones is prolactin. And if you're making too much prolactin, then this is something that we see quite commonly.
Prolactin is often called the milk hormone because its main function is to stimulate the breast in women after childbirth. In men, some prolactin is normally produced, but at much lower levels than women. Overproduction of this hormone in men could indicate a serious underlying problem.
The commonest cause of making too much prolactin is actually a little tumour, which we call a prolactinoma. In you, because this has been going on for a little while, I suspect that you have a large-ish tumour of the pituitary, OK? Now, when I say tumour, don't immediately think the worst. It's a slow-growing, benign tumour that gradually secretes a hormone, and we can control it with drugs to stop it doing this.
OK.
The pituitary gland is found at the base of the brain and is normally around the size of a pea. Dr. Christian suspects Amir may have a swelling in his pituitary gland, causing the overproduction of prolactin, which tells his body to produce milk.
So what I'm going to do really urgently is send you straight off to see a consultant endocrinologist, a sort of hormone and gland specialist, to do these blood tests and to give you a head scan, and then from there we decide what we do after that. All right, how do you feel about all that?
I feel OK about it, yeah.
It's probably a bit of a shock, isn't it? You weren't expecting that, but we know how we can treat it, which is good news. All right?
Yeah.
OK, Amir, thank you for coming in. All right.
19-year-old Elizabeth. She's got an ailment that's been kept under wraps for 6 months.
Talk to me about your toe. What's happening?
It's been infected for about a year.
Okay.
I went to the doctors and then they gave me antibiotics and they didn't seem to do anything.
Okay.
So I just stopped going and now it's been in my sock for about 6 months.
When you say it's been in your sock, please don't tell me you've been wearing the same sock for 6 months. If you have, I'll smell it.
No, I do change my sock.
Right.
But like when I keep my sock on when I shower and then change it without looking.
Why won't you look at it?
I don't know, I hate it.
Can I see it, please?
Yeah.
Okay. You've got a very healthy nail bed there, but at the top of it, you've got a very, very thickened nail. On top of that, this nail is ingrown. Can I see the other one? This nail is actually worse than this nail. You don't want to look at this at all.
No.
It's your toe.
No,
You're never going to look at it again.
I can't.
I'm going to take a little clipping for fungus, OK? We could have a host of things in here. They're a bit pongy, I'll be honest. We'll send those off to the lab, we'll check out what's going on there, but I foresee these nails coming off.
Find out whether they're coming off or staying on. They've been sent to the Embarrassing Bodies laboratory for Professor Val to investigate further.
Well, I did see something down the microscope, and I have seen a fungus, but not what I was expecting. This is an alternaria, which is what you can get in the bathroom. It's certainly not the fungus that would normally cause problems in nails, but this girl's nails must be really bad.
Elizabeth's fungus-infested toenails require specialist care. Today, she's got an appointment with foot and ankle surgeon, Mr. Anthony Pereira at the Spire Hospital in Cardiff.
Let's have a look at this. Now, you have got some ingrowing toenails on this side and here as well, which do leave you prone to having repeated infections.
Ingrowing toenails occur when the nail cuts into the side of the skin. The cause is unknown, but cut your nails straight across rather than short and low at the sides, and you're less likely to develop them.
problem is that the whole of your nail is affected, and so you may wish to consider having the nail taken off.
I just want them gone. I really hate them.
If surgery is successful, Elizabeth's toenails will never grow back. At only 21 years old, Jay confesses he wasn't encouraged to brush his teeth as a child.
Over the years, I've eaten the wrong foods, I've drinking lots of fizzy drinks, and I haven't really taken care of them I haven't really brushed them or flossed or anything like that.
The worse his teeth became, the more frightened he was to visit the dentist. But now dental-phobic Jay must find the courage to open wide for Dr. James.
It's going to be a really big smile, like super cheesy. Yep, there's a lot going on, isn't there? Yeah, I mean, it's not that you're suffering from sort of gum disease as such. I mean, maybe a little bit in some areas, but it's just decay.
Jay's teeth are caked in tartar, hardened food debris and bacteria that's built up over around 20 years of not brushing his teeth.
I'd like to get everything cleaned up around some of the teeth that are maybe savable, just so we can really have a look and see what's going on, because there's just so much stuff over them that can't really see that well.
He sends Jay to a hygienist who blasts away the tartar with an ultrasonic scaler. But how deep is the rot? Dr. James orders a CT scan to help him see the full extent of Jay's decay.
So we've got Jay's x-rays back, and as expected, things are pretty bad. Jay needs to lose about 11 teeth, maybe a little bit more depending on what we find. On the flip side though, there is some good news. Where Jay's teeth are obviously very, very decayed around the tops, the roots and the bone around those roots is actually quite healthy. And as such, I think that Jay might be a suitable candidate for dental implants.
Dental implants are the super high-tech alternative to wobbly dentures, but they're very expensive. So Dr. James will not give Jay this treatment unless he changes his unhealthy habits.
It's sort of change your lifestyle time. Cut down on the fizzy drinks, or actually just stop. Cut down on the sweets, start brushing your teeth, start trying to floss, especially once we've got things cleaned. You know, all those are things you've got to commit to right now and say, I'm going to change that. You know, is that something you are going to do?
Yeah, I'm willing to give up all fizzy drinks, and I'm now more into a routine, so I'll be able to brush when I get up now.
So with Jay's promise to reform in the bag, the next step is implants. As a bin man, he admits he spends more time keeping the streets clean than his teeth, and the rot is so bad it's holding him back.
I'd like to work in sports or physiotherapy, but because of my teeth, like, it doesn't really feel right to do it. I feel embarrassed to tell somebody how to look after themselves when I haven't really taken care of my teeth.
Sometimes all that appear to be nits aren't necessarily nits. Just ask 13-year-old Maria and her mum Kim.
Makes me feel sad, depressed and that, because they all call me names like I've got diseases and nits. They really tease me at school. I find it really frustrating because it's itchy and sore and it bleeds.
Actually, Maria has scalp psoriasis, and nothing she's tried can shift it.
It's very thick, isn't it? The scales are very thick. But you don't really have any part where it's clear, do you? It's all over, really.
It started off just with a couple of little patches, and over time it's really got worse. I mean, it's quite bad at the moment, but sometimes it's worse than that, where it bleeds.
So, yeah, I can see, look, there's a very big patch there. I can see how it bothers you falling onto your clothes. Now, what actually happens in psoriasis is your skin sheds cells hundreds and hundreds and hundreds of times faster than your mum's, for example. And that's why you get all that flakiness. You're not alone. About average 3 in every 100 people have the tendency to develop psoriasis over their lifetime, okay? Importantly, for all those girls at school, this isn't something that you've caught from anyone, and this isn't anything that you can pass on to anyone in school. I think it would be worth seeing a specialist to have a look with you to try to descale this, first of all, and secondly, get rid of any inflammation, any redness that's on the skin underneath, and hopefully make it less itchy and try and break the cycle of this.
Although there's no definitive cure, there are things that can be done. So Dr. Pixie's sending Maria to Birmingham to see a hair specialist, or trichologist.
We're hoping this is going to be the first stage of actually relieving the condition, even if it doesn't cure it.
Yeah.
Just to relieve it will be an added bonus, won't it?
Yeah.
Carol Walker's treatment comes in 4 stages. First, she adds a cream, called a keriolytic, to soften the skin.
So I've applied all the cream into the areas. Now I'm going to now put you under the steamer. There we go.
Next, a hair wash. The treatment has dislodged much of the loose skin. Everything's ready for the climax, a thorough combing. After another 3 sessions, there's a new bounce to Maria, and Dr. Pixie wants to hear all about it.
It's got better, really better.
Has it?
Yes.
And have you noticed a change in Maria's confidence levels, Mum?
Definitely, she's much more confident. The bits falling out of her hair's a lot better. So she's now got it all hanging down and restyled instead of being swooped back in a ponytail.
Yeah. No, it's lovely. You look totally different. You really do. Can I have a look? Yeah. Would you mind? Just pop your head down for me. I don't want to mess up your lovely hairdo. When we last met, I'll be honest with you, the minute I went near your hair, there were flakes and you could hardly see the hair for the flake, and it was really thick. And actually, the quality of your hair feels much better.
It is, yes. Twice a week we do it with the lotion that we were given by the specialist, and make sure it's well softened before combing it through. So.
Hi, how are you? Take a seat there for me. Nice to meet you. So what's brought you into the clinic today?
Basically, the problem is, in my hands and my feet, they seem to sweat excessively. My feet are a lot worse than my hands, hence the skin on the bottom of my feet sort of looks like it's rotting. It's very pitted, very bitty. The skin can get very sore and crack and bleed. Obviously, because my feet are always wet, they continuously smell. I've used emery boards on my feet to try and file the skin down. Razors to try and scratch the skin off so that it looks smooth and normal. Everything, really.
Oh, no. That's awful. You poor thing. Oh, my God. Well, look, let's have a look at these feet and see if we can do something for you.
Please, yeah.
OK. So you get quite bad holes and things in here, don't you?
Yeah, it's sort of pitted. Yeah.
My feeling is that you've probably got some bacteria in, forget the sweating problem.
Okay.
But actually what's happened is you've now got some bacteria in here that are making the whole thing...
Rotting my feet away.
They're rotting. They're putrefying, they're rotting. Yeah, absolutely. There's a particular bacteria that you can often find in sweat called Corynebacteria, and it can be quite smelly, and it also causes a low-grade inflammation and infection. So I'm going to take a swab, all right? And then I'm going to take just a little scraping of your skin cells as well, and we'll get that off to the lab.
Okay.
I totally get what you're saying about the look of them and how they're uncomfortable. I totally get what you're saying about the smell of them. And I do not think there's nothing that we can do. I think we can help.
Thank you.
Annette has a really bad problem with hyperhidrosis. There may also be some bacteria or some fungi that are making the problem worse.
I've got some skin scrapings and a swab here from Annette. Dr. Pixie says this lady's got real problems with sweaty feet. She's got an awful lot of bacteria on her feet. Some of them are yeasts. And also anaerobes. These all smell and they'll all contribute to a problem. I think Dr. Pixie will probably have to reduce numbers by giving us some topical treatments.
For 2 weeks, Annette has been using antibiotic creams on her feet to kill off the bacteria.
Since, obviously, I saw Dr. Pixie, the skin on my feet is a lot better. Been using the cream as I've been prescribed and the antibiotics. I can now bear to look at it a little bit more. It's not as pitted and as split, and it's not been bleeding or sore as it was when I saw her.
The next stage of the treatment is to control her very sweaty feet. Dr. Pixie has given Annette an iontophoresis machine which aims to reduce excessive sweating.
A little bit nervous about using the machine because obviously I don't know what to expect and what it's going to be like. So we'll just have to wait and see how it goes, and hopefully I won't electrocute myself.
No one knows why this treatment is so effective, but one school of thought is that the mild electrical impulses block the sweat ducts without damaging the sweat glands. Just 15 minutes every day for a week should see an improvement.
I'm sort of like pins and needles, but quite sharp. I'm really looking forward to the outcome. I'm hoping hands and feet are going to be dry, so I can finally get a nice pair of shoes or be able to hold hands or touch things and my hands won't be soaking wet, and neither will my feet, so it's going to be good.
Click on screen for more videos of extraordinary humans.